Hey everyone, my name is Kerry Daigle and I am a sports agent actually. Been involved with the Juice Plus company that you're going to hear about in just a minute for over 30 years along with my beautiful wife Mickey, who actually introduced this wonderful company to me. And I really do appreciate, Mickey, everything that you've done to help us grow our business. But today's a special day. I was given the honor to be able to interview someone that's an ambassador to the Juice Plus company. And I wrote a few notes down because there's so much about Dr. Rick DuBois that many of us don't know. Now in Louisiana, I'm French, so sometimes we look at the last name and we have a tendency to say DuBois because it's French, DuBois. But it's DuBois, Dr. Rick DuBois, out of his home in Georgia. Dr. DuBois, how are you today?
I'm doing great, Kerry. Great to be here. Thanks for having me.
Yes, sir. It's good to have you, Doc. Let's start our conversation off with you and your background. I understand that you are a retired board-certified physician of 42 years and you specialize in infectious disease. Now, for all the listeners that are here today, would you mind explaining to the audience exactly what is an infectious disease physician and who were your patients?
Well, we are a specialty that, of course, involves ourselves with infections, bacteria, viruses, and others that invade the human body. We are frequently consultants on cases where the primary care doctor can't solve the problem. Post-operative patient has an infection, can't solve the problem. The infectious diseases physician is often called in. The other time is they'll know what the problem is, but they can't identify what is the right antibiotic to use for a given infection. That they can identify the infection, but they can't identify how's the best way to treat it, or how's the best way to treat it given the circumstances of the kidney function or the liver function of the patient. So pretty much in the hospital, we're consultants.
Oh, wow. Okay. Very interesting. It opens up my mind so I can better understand exactly what infectious disease physicians do. Now, Doc, you've been awarded numerous honors and proclamations of prestige for many of your colleagues. You were the past president of the Infectious Disease Society of Georgia. You were involved with the past president of Georgia Society of Internal Medicine. You were also the past president of Medical Association of Atlanta. You were the medical director of the first maximum containment treatment facility for the CDC. That's the Centers of Disease Control. But what really has caught my attention, and you can find this, well, I got all these accolades as a physician, and Kerry's going to bring this up. What really caught my attention is your stint in the Navy. What would you mind sharing your time in the armed forces?
Yeah, I had 4 years in the Navy. My first assignment was Hawaii, and I was medical officer for about 3,500 sailors, Marines, and families, children and all. And we ran a moon relay station. We were across about 2 pineapple fields from Schofield Barracks, and we had a big thing looked like an angel with its wings down in our cornfield, or our pineapple field. And we didn't have satellites back then, so we would bounce messages off of our moon down to our satellite, then we'd bounce it back again to Washington, so nobody could intercept the messages. So we were top security clearance because we had critical messages going between Asia and and Washington all that time. So that's right in the middle of the pineapple patch.
That's really interesting, Doc. So you've been involved. No, go ahead.
then after that, I was regular Navy, and there was a war going on, so I couldn't resign after my tour of duty in Hawaii. So it actually occurred to me, my children asking me, Dad, what did you do in the war? So I volunteered for Vietnam, and I ended up splitting time between the USS Repose, which is a hospital ship, and the U.S. Naval Hospital stay at the Da Nang Air Force Base, or Da Nang Naval Base in Vietnam. So I was back and forth between ship to shore there to give those guys on land a little opportunity to get out to sea. So I spent a couple of years there. Mostly it was malaria, mostly it was fevers, mostly it was things like Tsutsugamushi and strange diseases we don't see here. But I had taken a course in tropical medicine, so I was prepared to take care of those people. And then during that was mostly the morning shipment of patients that would come in from the hospitals. We would go up and down the coast looking for the casualties, and they would come to us by helicopter all day and night. Mostly shrapnel wounds, gunshot wounds, explosions, all kinds of things, snake bites. During the daytime, if my patients were all stable, I'd scrub with the neurosurgeon. And he was quite a guy. He says that he used to say, "Now be careful, that's second grade."
That's interesting. Doc, I want to apologize that all I have is 1,000 lines and we filled up. It's completely full at 1,000. We could have had a lot more people, but I'm going to promise you that I'm going to record this and send you a copy, and you'd be happy. You can share it with whoever you choose to share it with. Now, Doc, I remember meeting you for the first time in Atlanta, where we were attending a health seminar, and you were in the audience. I remember you wearing that red jacket, that famous red jacket. And there were several well-recognized individuals that were telling me about you attending, and they wanted me to meet you. How did you get there, and why did you attend?
That was my lycopene jacket. So that was about April or May of 1995. I had just gone through 15 years of treating HIV. We went first several years, we didn't even know what caused it, let alone how to treat it. And during those years, Carrie, I lost almost 300 patients a year to AIDS. And it was a long thing. But what I learned from my patients was they had poor nutrition. And those who had the best nutrition did the best with their HIV. So I was introduced to Juice Plus capsules and invited by another doctor to come to this meeting at the Wyndham the Marriott Hotel on Windy Hill Road and listen to you and a couple of other people talk about the value of Juice Plus. And I said, this is what my patients need. In fact, this is what I need. And as a matter of fact, back then, you still can't buy it in a store. So in order to facilitate my patients getting it, I signed up to become a representative right away.
Wow, that's an interesting story. I remember that day so well. I didn't remember where you were sitting. You were sitting on the very end seat around the middle of the presentation, right in the center, around the center on an end seat. I remember that so well. Now, Doc, since that time, you've really spent an enormous amount of time researching the validity of Juice Plus, which now has, we know, 40 published studies in peer-reviewed medical journals. What prompted you to investigate Juice Plus at that level?
Well, it's the beauty of the science that was involved with it. You know, back then, vitamin supplements and other over-the-counter materials never had any research associated with them at all. But I was talking with leadership of the Juice Plus company, and there were some men with integrity. One in particular was John Blair, who was involved with the product. He and I had some long conversations about Juice Plus and where he planned it to go. And I was right along with him. I said, let's do this. And they began the research. We started slow with pilot projects just to prove a point. But after that, it was clear what we needed was gold standard, double-blind, placebo-controlled research. And all of our research since then has been that high-quality, double-blind, gold standard research. So it's been a pleasure to keep up with voraciously every new study that comes out. And our studies have become more and more sophisticated as we go along. It's really, really wonderful what we've done.
Well, I've seen you speak all over the world, actually, not just in the United States of America, but Europe and Canada. You've been all over. You've traveled all over, speaking about the benefits of good nutrition. What's really interesting is what you just mentioned about all the studies. What studies really stood out to you, Doc?
Well, the very first ones were simple studies, bioavailable studies, but they were good studies, and they showed efficacy. They showed this product really works, and this product should work, and the ramifications of this were very, very significant. And then I realized not only do my sick and dying AIDS patients need this, everybody needs this, because as I learned more and more about nutrition, I realized the value of phytonutrients and antioxidants, because I had no training in that. And when I realized that this is the foundation of human health, whole food, plant-based nutrition, so this is important not only for my patients, but for my family and for myself. So I'm going to stick with this company, and I'm going to keep up with all of the literature that they have. I think one of the most impressive research studies that we have was done at the University of Newcastle outside of Sydney, Australia. We've got several studies that show Juice Plus protects our DNA from damage. And you say, well, why should our DNA have damage? Well, every day in our bodies, we have chemical reactions, and those chemical reactions generate sparks, and the sparks damage everything they touch. We call them free radicals, trillions and trillions and trillions per day. It's part of our normal metabolism. That damages everything it touches, including our DNA. Well, our DNA has been calculated that 10,000 times a day, 10,000 times a day, the DNA in every cell of our body sustains free radical damage. Now, you cannot repair your DNA. I mean, you cannot replace it. You're born with it. It's all you got. You have to repair it. If you make a mistake repairing it, you've got a mutation. If you don't make a mistake, the cell either doesn't work or it dies. So that's bad. You've got to repair your DNA. Well, you got 10,000 times a day of this damaging happening. Well, you've got Juice Plus showing reduction in the DNA damage by 70%. And then there's another study came out more recently outside of Sydney, Australia, University of Newcastle. We got 22,000 genes. Wrapped around those genes is more DNA. And when I was in medical school, we used to refer to it as junk DNA because we didn't know what it did. And it turns out 90+% of our DNA is junk DNA. Well, it turns out the junk DNA is called the Epi Genome. Your 22,000 genes are your genome. You can't change those. You're born with them. But your epigenome modifies how your genome works. Tells it to speed up or slow down, or tells it to stop completely or reverse, whatever. So your epigenome actually helps to control your genetic code. Well, it turns out all of this junk DNA is your epigenome, and you've got 4 million switches, we call them switches, in your epigenome that control your DNA. Now, you say, what does that mean? Well, we did the study because what modifies our DNA, our epigenome? We can't change it ourselves. We cannot change our DNA, but we can change our epigenome with malnutrition, with pollution, with stress, with poor dietary habits, and we can improve the function of our epigenome with nutrition, particularly with whole food, plant-based nutrition. And the University of Newcastle said, well, the epigenome responds to plant-based nutrition. Juice Plus is plant-based nutrition. I wonder what Juice Plus will do for our epigenome. So they did that study, 80 participants in the study. And they looked at it for almost 3 months. And they looked at the epigenome, and Juice Plus impacted 1,600 epigenetic functions. Now we got 22,000 genes, but 1,600 of these were modified, we couldn't look at all of them, by intake of fruits and vegetables. Things like insulin resistance and like LDL cholesterol controlling epigenomes. Things that control parts of our immune system are all modifiable by our epigenome, and our epigenome is modifiable by what it is we eat. Whole food, plant-based nutrition. So I think this is our best study. I think we're going to have many more studies. We'll continue our research. Our research, as you know, is ongoing, and it's all double-blind, placebo-controlled now. And the epigenome and the function of the epigenome is very important in things like cognitive decline and memory and retention and things like that. So Juice Plus is going long-term with our research now. We're looking at all of our products. We're going to include Complete in our product now because Complete is a very fine product, and we're going to include Complete in our product. Our brand new product, Berry Plus, we're very proud of that. Twice the recommended level achieved by bioavailability in half the time with half the dose in volunteers taking our Juice Plus berry. It's called the omega-3 index. So we're going to continue our research with that. Juice Plus is the most researched product in the world. You can ask Siri, you don't have to ask me, but we're going to make sure that all of our products become the most researched products in the world, and that includes our Complete and our Omega, and probably our chewables as well.
Wow, Doc, you just mentioned, this is going to be a twofold question, I guess. You've been an international speaker and a lecturer on good health. What tips can you give these listeners today? And what's the difference? Why do we have 40 studies and all these supplements don't have any?
Well, to answer your first question, if you go to any country in the world, go to the health department of any country in the world, you can go to the NIH, the National Cardiology Association, Sweden, any country in the world, and ask them, how can I maintain health and reduce the risk of disease? And they're going to say, eat more fruits and vegetables. That's going to be the first thing they say out of their mouth. And it's true. And the sources of our fruits and vegetables are getting more and more questionable. Source of our fruits and vegetables has to be questioned all the time. Our quality standards are so important. We have the NSF certification guaranteeing everything that's in our bottle is on the label, and there's nothing in our bottle that is not on the label. As you're aware, the Attorney General of New York State went into several stores, Walmart, Walgreens, Target, and GNC, took bottles off the shelf, tested them, and issued cease and desist orders because the labels did not match the contents of what was in there. So that will never happen with Juice Plus because of our NSF certification of every product we have. So the other thing is that we're going to continue our research because it sets us apart. There are so many wild claims out there about this, that, and the other thing, particularly health-related, diet-related, strength-related, age-related things out there that are making all these ridiculous claims that just they have nothing to back them up. Our product has integrity, our product has research, and our product will continue to maintain itself as the most thoroughly researched product in the world.
Wow. Wow. When I hear these words coming from you, Doc, and just knowing your background from this interview and hearing what you've done as a medical professional, as a physician in your field, to be able to say those things, it's so exciting. And it's incredible that everyone listening in can learn from you. I mean, you are absolutely the epitome of what it's all about when someone is, who do you look up to? Who do you pay attention to? And man, this is some great information. Now, for everyone that's listening in, Doc, final comments for the audience. What would it be? What lessons could you give the audience before we say, have a good weekend?
Well, I think what you want to do is maintain health, reduce the risk of disease. And of course, there's those 7 things you can do: sunshine and exercise, manage your stress, get plenty of sleep. And main thing is eat right, eat real food, eat fruits and vegetables, lots of them. And when you can't do it, bridge the gap by adding Juice Plus to your family's daily routine.
Well, Doc, I just appreciate your time today. There's some kind of pointed questions in there, very generic, but we wanted everyone to know who you are, especially a lot of these new blood that's joined our company in the last couple of years and didn't have an opportunity to maybe hear you live or meet you personally. But today, because of the power of technology, from all over the world, people are tuning in and they're listening to Dr. Richard DuBois. And I'm excited about that because it's so deserving. I want everyone in the world to know about you and what your history is, and especially the information that we picked up today in this interview. I'm gonna go ahead and stop this recording and let everybody tell you goodbye and have a good weekend. 1 minute.
Thank you, Kerry. I appreciate you having me on.
You're welcome.